I'm Dr. Rick Buck, and I've been a dentist for 18 years. Crazy things happen all the time in the dental chair, and the patient never really actually knows when they're happening. Once in a while, I catch some of these crazy things on camera. In this video, I want to go over the grossest or most eye-popping things I have actually caught on camera since I've been doing this for my channel. Here I am getting the patient numb for an extraction because I can see a large infection on the x-ray for this too. However, you can also see puffiness in the gums when I look in the mouth, and you can see the puffiness right here on that palate. So when I start numbing the patient, there is so much infection in this area that it starts oozing from the tooth. Now, it's typical with a large abscess that you will see gums fill with pus and infection. And so when you press on the gums, sometimes you'll see the infection seep out of the gums or out of this little pimple-like abscess. However, when I pressed on the gums of this patient, the pus mixed with blood started oozing from the tooth itself, which is crazy because that means the decay in the tooth and the infection both are so bad that it made a path for it to secrete the pus from the tooth. But sometimes I use this as a demonstration to show that the abscess in the gums is often related to the tooth. And what's happening is the infection finds a way from the tooth to the gums. And you can see here that they are definitely connected to each other. Now, the point of this originally was that I was just extracting the tooth. So now I start that by wiggling the tooth until it finally comes out, which is always cool, no matter whenever I do one of these extraction videos. But even after I take out the tooth, I grab this instrument called a spoon, and you can see me scooping out some of the infection, and a lot of it's once again mixed with blood. So this is all just crazy how big this infection was to see. But now, just to be a little more fun, I grab the extracted tooth and play with the infected granulation tissue that's stuck to that tooth. Now, this is very common to see, which is kind of like scar tissue that's just infected around the tooth. Now let's move on to another one. So one day I had this patient out of the blue come into my practice, and he had many insane things happening in his mouth. He had this massive buildup on the teeth that I've never seen before. Like, this is plaque that's been there so long, it's just hardened into what we call calculus. Most people that aren't dental professionals don't know that plaque, once it builds up on your teeth, it starts to harden in time and form this layer called calculus. And then what happens is this calculus firmly attaches to the teeth like barnacles. And so oftentimes when you're having deep cleans, what they're actually doing is cleaning off this hardened calculus that's attaching to the teeth, once again, like barnacles. Now, to take it even further, like here, if it gets out of control, the calculus could start a bridge among the teeth. And so that calculus is so hard and attached to the teeth, it acts like a splint, splinting the teeth together. So here I am in this case, I had to actually do an emergency cleaning on him because it was causing him so much pain. And I'm just cleaning chunks off. And yes, I think this is actually kind of very cool and satisfying when you're pulling these chunks of calculus off the teeth. But here's the kicker, because even though it splints the teeth together, at the same time, it eats away at the bone and ligaments that hold the teeth into place. So this patient had teeth almost completely unattached from the bone underneath, but at the same time they're staying in place because they're splinted together by the calculus that has formed a bridge. But you can see as I'm cleaning it away, you'll notice the teeth are getting really loose. They're no longer splinted together. And so while I'm cleaning, I'm having to put pressure down to hold them into place so they don't come out. But ultimately, for one tooth, it's of no use because as you can see, the tooth is so loose that my assistant who's suctioning sucked out the tooth while I was out of the mouth. I mean, this is so unbelievable. And I'm just gonna slow it down and show you once again because it's just so unbelievable that this could even happen. Now, here is another crazy thing among all the crazy things that happened with this patient. While the patient was getting numb, I took a sample of his plaque and looked at it under a microscope. And what I saw was something a dentist would rarely see in a microscope, even with patients with really bad gum disease. Can you see this little guy with his little tail just flickering and swimming all around? He's swimming in a pool of bacteria. So that little whip-like tail propels it and gets it stuck into a plaque matrix. And that's where I'm able to see that this is a parasite called a trichomonas, which are more commonly found in STDs. However, this type is only found in the rarest and worst types of gum disease. It just so happens we got to see it whip into place in the plaque matrix, and this is just crazy. Okay, so now let's move on to another patient. This patient lost 2 of their teeth and decided to have them replaced with 2 implants. After the bone has completely healed, I make an incision in the gums and peel back the gums. Immediately, I noticed that this patient has a lot of blood vessels pumping small amounts of blood to the surface. Nothing too bad so far, so I start drilling sockets into the bone as you would normally do, so eventually implants are going to go into these little sockets. But once I've drilled down to the correct depth, I start widening these sockets with a series of drills, each one bigger than the last. Eventually, I stop at the size I want the implant to be. And now what you're seeing me here do is I'm putting the implants into these sockets. But it's important to know I'm not going to put in the teeth right away. These will take months to integrate with the bone. Meanwhile, what we do is we put these healing caps on the implants while they heal. When I do that, in this case, it puts pressure on those arteries, and it's like a thumb over the nozzle of a hose, and you can see the blood vessels just start squirting blood, and I can barely capture it all on video. And it doesn't just happen once, it starts happening twice again. It starts squirting that blood. It's just kind of awesome and kind of gross to be seeing this. And it's one of the few joys you get to see as a dentist. Once in a while, you'll just have blood that starts squirting. Before I get to the most mind-blowing part, you need to watch my video on how to get your teeth stunningly white, or my video on the best way to brush, floss, and take care of your teeth to avoid bad breath, cavities, and gum disease, linked to at the end of this video. And all the best products, which are my products from those videos that will get you those incredible results, are linked to below in the description of this video. So now let's move on to another one. Now this one I wasn't filming during this procedure, but then this tooth had a significant amount of decay and the patient didn't want to save the tooth. So as I was pulling the tooth out, the crown fractured off. And you can see me kind of playing around and pulling that crown off. But then what happened was it left the pulp chamber exposed underneath. And that pulp chamber houses the nerves and the blood vessels within the center of the tooth. So I started filming this after I exposed it. And then what I did was I just started to grab it with my cotton forceps so you can get a feel of what these blood vessels and nerves in the center of the tooth are like. And I can tell you this is dentistry at its finest. This is kind of one of the fun things we get to do, and the patient has no idea that any of this is going on in their mouth while I'm working on them because they're numb and they can't even feel it. Now let's move on. I don't know how on earth this happens, but sometimes crazy things like this come into my practice. This tooth is completely fractured in half, so naturally I numbed up the patient and I started wedging the pieces of the broken tooth apart, and it's so badly broken that this is how it looks. In fact, this has been badly broken and infected for so long that it's not even really holding on to the bone, it's just passively holding on to the loose gum tissue. So now instead of wedging it apart, I have to separate it from the gums as it's already pretty much completely separated from the bone and tooth. It does take me moving it back and forth quite a bit until it eventually gives way and I take out that piece. As it comes out, I show it to you and you will see it as half of the tooth. This tooth fractured vertically and split the root in half, or at least 2 of the roots in half. And part of those 2 roots are still in the mouth, and then the 3rd root is still in there as well. So now I slowly put pressure back and forth on the other piece. Time and pressure is what loosens this up without breaking it any further. And voila, 2 roots split in half and the 3rd root come out with this other piece of tooth that was left behind. But even more than that, we get an extra little surprise with this granulation tissue that's stuck to the root. It's pretty gnarly how it all just completely split in half, and you can just see how it comes out and what's left behind, and what people don't even notice is happening in their mouth. They had no idea this tooth was broken for so long. All right, so here's another one. This patient came in with a stainless steel crown on top of the tooth. But you can tell on the x-rays that underneath the tooth, It was infected. So we put a rubber dam to isolate the tooth and started drilling into the tooth. I didn't know at the time when I was filing the tooth that I was opening what I'll call a pus fountain. Now, the infection starts to slowly come up. Normally I would just have my assistant suction all of this out, but since I'm filming, instead I start putting pressure on the gums so it flows out much more until we can just like see it all. And what you're seeing is the oozing of the pus and a little bit of the blood mixed together. This doesn't happen all the time. Most of the time the infection just stays around the abscess, but if you're lucky like we are here, the infection starts boiling up until we eventually have to start suctioning out all of the infection. It's gross, but somehow it's also a little satisfying, you gotta admit it. Now here's another one. This patient was told 5 years previously that this tooth needed to be extracted, but she had a wedding and didn't want to have the tooth extracted that day, so I made her a temporary fix with this crown that goes on top of it. But it was so good that she just never even came back in to have it taken care of. So when I press on the gums or even start to wiggle the tooth free, you can see the pus oozing out of the side of it. And so eventually the tooth gets really loose and I pull out the tooth. And when I do, you can see this large string of infected granulation tissue that comes out with it. I love it when this happens. I think it's so cool. And because I think it's so cool, I had to play with it just a little bit to show you on camera what it's like. This is all infected and causes a ton of pain when it's in the mouth. Now, before I let you go, as a bonus, here are a few times where I pull the nerves out of teeth when I'm doing root canals. These are just some of the fun, gross, but gratifying joys of being a dentist. If you want fresh breath, really white teeth free from cavities and gum disease, watch my videos linked to now or click on the links below for my best products. If you want to schedule a virtual consultation because you're interested in composite veneers, schedule it from one of those links below. If in Southern California and want a dentist, my office is also linked to below. I do implants, all-on-4 dentures, cosmetics, and everything else.